Heart attack is something which is everybody understands. Everyone has seen or heard about something.
People sort of neglect. They don't really know how exercise or fitness can actually help with brain health. Today we have Dr. Gaurav Goel, who is the director and head of neurointerventional surgery at Medanta Hospital in Gurugram. Welcome to the Odds Fitness Podcast. Today we have Dr. Gaurav Goel, who is the director and head of neurointerventional surgery at Medanta Hospital in Gurugram. Welcome to the Odds Fitness Podcast, Doctor. Today I want to pick doctor's brain on longevity, general health, and overall well-being, and some of the diseases that doctor might come across which have a correlation with better lifestyle or exercise. And maybe he can give us a few ideas on how we can have a longer, better health span and lifespan in general.
So, thank you so much for calling me here and thank you for this great opportunity. I want to start with whenever you call a doctor to the show, I hope the audience is not expecting free prescriptions from us.
Not free prescriptions, but definitely, we look at life as this thing which goes by and people assume that disease is going to come, or if it happens, it's probably bad luck, and we don't really have many things in our control. While I was talking to you, I understood there's so many other dynamics at play, so many factors at play, which people can probably focus on and anticipate what are certain things, lifestyle factors that they can, adhere to in order to prevent certain diseases.
So, it's absolutely true. We cannot generalize everything, but a lot of it is what we make decisions in our youth, how we treat our body. Do we take care of it? Do we abuse it? And those choices eventually will have significant outcome as we go into our lives in future. So somebody who is at a very youngish age and he thinks I'm too young, the body is healing by itself, you don't take care of it, you will have a lot of neurovascular, cardiovascular, and whatnot other risk factors going into the life. So I think that's where it's very imperative that a show like yours is trying to highlight these issues,
Right.
that we can stop them from coming rather than worrying about them when it's already there.
Correct. People sort of neglect. They don't really know how exercise or fitness can actually help with brain health or neuron health. They don't even focus on it. Maybe everybody has their narratives that they want to play out. And we're dealing with so many things in general, like being in a metropolitan city, having the stressors of life, trying to create a future for oneself, trying to make a career out of oneself. You being a doctor, I'm sure you were career-driven and also excellence-driven. Therefore, you are who you are. What advice would you give somebody who wants to focus on being excellent at something, is very ambitious as well, wants to create wealth for himself or a name for himself? How does someone like that balance their lifestyle and play out their narratives for much longer, so to speak?
So I'll start with my mentor's example.
Right.
Great neurosurgeon, superb guy, I think one of the best in the country. And he had to retire early because the disease just caught up with him.
Right.
So he didn't exercise, I think probably never in his life. He had sugar, blood pressure, and he will still not stop. He will keep abusing the system to the point where at some point the system will say stop. And your career, instead of going for like 80 years, you may have to stop very early. And there's a lot of cricket things going around. So I'll say all these things are like a test match. They are not like a 2020. So
Right.
Unfortunately, we are dealing with life, looking at it from the next 5 years, 10 years, where I want to be, where I should be. But if you are, let's say, 30 or you are, let's say, 40, your aim and goal is not to reach just 50. Your aim has to be reaching in good 70s, 80s, where whatever wealth you achieve, whatever success you achieve, name you make, you should be able to enjoy that.
Right.
And you will be only able to do that if you are in pink of your health. If
Okay.
you are in your good health, then all these things make sense. If not, it doesn't. I don't want to use the cliche that, work-life balance, it doesn't exist. So it's impossible to get a work-life balance in metros. But at least 80% work and maybe 20% time to the engine which is generating all this is not too much to ask for.
Right.
So that's where I do recommend exercise to my patients. And it's part of my prescription to most of my patients. Whether I operate them, whether I don't operate them, my mantra for getting them back successfully on their feet is go and exercise. And by exercise, I by no means mean go to the gym and lift heavy weights or do some guided trainings. Just go out for a walk. Do brisk walking for 20-30 minutes. Do what your body is comfortable with, but do it. And that should help.
Right. So movement, you would say.
Slightly more than movement. Like put your body to some task. Like
Right.
just don't stroll around in the park and come back. But
Right.
if you are like 70 and just, spent the last month in the hospital, maybe that's exercise for you. But if you are 30, just strolling in the park is not an exercise for you. So something which pushes your body limits, pushes your joint limits a little bit has to be done.
Is there a way where for lay people, they can quantify it?
Yes.
Okay.
So we use smartwatches,
Right.
fitness bands.
Right.
You look at your baseline heart rate.
Okay.
The idea is to double your heart rate at some point of your exercise. Now, there are zones which you people will be able to talk better than me,
Right.
but something which should be doubling your heart rate at some point of time, not all the time, but at some point of time, is your recommended exercise goal.
That would be double of resting heart rate?
Resting heart rate.
Okay. Okay. Oh, that's amazing. And what are the benefits that one can expect out of something as simple as what you recommended?
Okay, so I'll say something which everybody will be able to correlate to. Maybe neurovascular is an unknown thing, stroke, brain hemorrhage, people may not correlate. Heart attack is something which is everybody understands. Everyone has seen or heard about something. And it's a very simple fact of life that medicines do have their role, but better than medicine, and these are scientific journals quoting, like leading scientific journals, that if you exercise 30 minutes a day, your chances of getting anything, a heart attack, a brain stroke, any other arterial disease of the anywhere in the body gets reduced by 40%.
Right.
And if we take any drug studies, any device studies, if they give us 40% benefit, that's a hit.
Right.
But this is something which you can do every day. You can do it by yourself, no cost. But since it takes a lot of effort, discipline, people don't do it.
So I'm assuming what you said in terms of cricket, whenever I give analogies, I say maybe like an F1 car, which is very high performance. But if you don't have a pit stop, and if you don't change your tires or check your engine, look at the pistons, look at the overall health and integrity, in all likelihood, you're not going to win that race, right?
Absolutely. So that's another example which is very great. And I'll say the word which you use, checkup,
Right.
that is also very important in this journey. As you try to maintain a healthy lifestyle, you should also do find to do a checkup. By checkup, I just don't mean a blood checkup.
Right.
So that should be a comprehensive checkup. But if you are 20s and 30s and you are able to sprint for next 20-30 minutes, you don't need it. You're fine.
Right.
As your body starts dwindling down in your late 30s, early 40s, that's the time when you need more extensive checkups. So
Right.
you may need maybe an echocardiogram, an ECG. Most importantly, I'm a neuro doctor, so I'm going to talk about the neuro disease. So most common things which we find is get an MR angiogram, which is just getting like an MRI, and so many lives can be saved.
Right.
I have a very tragic story to share. Like just yesterday, guy like us sitting in his office, young 35-year-old chap, working, dropped dead.
Wow.
Just dropped dead. Brought to the hospital, we found that one of his brain vessels has swollen and bursted, and it's a very common disease. Like we see this every day. The only solution to that is get once a year or once in 2 years one MR angiography done, and if there's something we can fix it. Exactly what you said. You need a pit stop to check your engines,
Right.
your equipment, that everything is working fine.
And is this test that you're talking about, the MR angiogram, can it predict accurately?
100%.
It's an expensive test, I'm assuming.
So, expensive is a difficult word.
Right,
So, I'll say this costs something like 10,000 in a private hospital, maybe a less in a government hospital.
right,
But if you compare it with what it can do, if it's able to predict that you have a chance of getting a major stroke which can leave you paralyzed, or you can have such a life-threatening hemorrhage, multiply that with the life saved,
right.
then it's a very cheap test.
And how often one must get it done?
So I'll say if you can get it once every 2 or 3 years, also it's fine. If you do it once and everything is okay, you can probably repeat it in next 5 years. If there's some minor things, your doctor will then can predict that okay, there's something you may need to do it annually. This is absolutely normal. Forget about it for 5 years.
Right. Wow. New thing I learned. The only things that I have probably considered for testing myself, I got a CT angiogram done to rule out any cardiovascular disease, carotid echo. I got the ECG. I haven't gotten a colonoscopy done yet.
So book you an appointment.
I will. I will. I will definitely be visiting you after this. So, when we talk about the brain, a lot of people sort of translate that to productivity, output, performance. What are the few things that maybe you would recommend for somebody to peak their abilities to perform cognitively or their abilities to sort of maintain good brain health and therefore do whatever it is that they're doing better, so to speak?
Okay. So we know the structures of the brain, we know how the wires crisscross, the layout of it, but then there is still a lot which we do not understand about the plasticity of the brain.
Right.
That let's say if some area gets damaged, some patients will just recover miraculously from it, some will not. So what makes that area plastic or recoverable?
Right.
So, what we do know is if you are young, you are able to do it better. If you are old, not so good.
Right.
The idea is to keep your brain young, not to keep it old. So,
Right.
if it's young, it will help you. Apart from your physical exercise, which is easy to do, you
Right.
also need to do brain exercise.
Right.
So, how do you lift heavy weights from brain to train it? So, one thing is meditation and yoga. So, you train your brain, your thought process, so that you have some control over it. And that is proven that it does prolong not only your health, brain health, your thought process. And if you look at all the successful people like Fortune 500 companies, whether they are educated, not educated, one thing you will always see is brain health focus. The second thing is good food. If you eat good food, you release good hormones in brain, and that also promotes good brain health. Whatever we like actually is junk food, unfortunately.
Right.
And that is what is not good for the brain. And it's all cliche, where we keep saying this again and again, that we should have good protein diet. And that good protein diet is actually supplementing brain health. Good sleep is another thing. So the combination of all these three things will help that. Now, if you cannot do meditation, yoga, if you're traveling, you're working, so you're stuck in a jam, you can do puzzles, you can do sudokus. Multiple games are there, color combinations. Try doing that 5 minutes a day, not for a long period of time, and it will help you. You can't do that also. Try learning a new hobby. Put yourself out of your comfort zone. Like, I don't know if you cook. If you don't, try learning it. You will see how your brain has to mold from your set routine, and that will prolong its life. It will help you to make better decisions. Try learning a new language. People who can speak three or more languages, they live much longer than people who speak just one.
Wow.
Many ways to exercise your brain, many ways to improve. So it's an engine. If it's sitting just idly, it will degenerate. It needs stimulation. It's morning walks, exercises. So we need to focus on that.
Right. Do you think, along with high protein, healthy fats are important as well?
Yes. So okay. So maybe I didn't communicate it properly. So I didn't just mean to say eat protein powder. No.
Right.
I don't want you to gulp spoonfuls of protein powders. No, it has to be a balanced diet.
Right.
So you need fibers, you need nuts, which will have fats also, you will need protein also, you will need carbohydrate also. Everything has a role. I'm not probably more qualified than you to talk about it. Maybe I'm sure you must be talking about it all the time. So if you take a balanced diet, that sort of helps it. If you are just overloading yourself with protein, it's just going to flush it out from the kidney. It's not going to go, because for body it's a waste.
Right.
So I do not recommend just taking protein. So we do recommend taking oils also. I ask my patients, go and eat samosa. It's fine, provided you're doing it like once a month.
Yeah, of course.
Okay. So it's fine. Enjoy that pleasure. But don't start eating chola bhaturas every day and expect that you will still be healthy. So it has to be a balance of your calories, portion control, focus on what my protein intake today is. Am I taking good proteins? Is it a mix of healthy fats, proteins, carbohydrate, fibers? That makes a healthy diet.
Right. So meditation, exercise for the mind, either a puzzle. Sometimes a lot of people have started playing racket sports,
Yes.
which really helps apparently.
Hand-eye coordination.
Right.
So,
So playing that sport. I've also seen having positive social connections, conversations with people.
yes.
That also.
Very, very true. Very true. And again, very scientifically proven. In India, actually, we are blessed.
You're blessed.
So we have a lot of social network connects, chacha, tau, mama, and extended families and support.
Correct.
But in Western world where they don't, and it is proven that if you have good friends whom you can have heart to heart, you can talk it out, you definitely live happier and longer
Yeah.
than people who don't. So have at least two friends in life with whom you can share everything.
Right.
It-
One इसलिए नहीं कि लड़ाई हो गई तो फिर then who will you?
Some competition is good.
Right. Now, when we are discussing about, let's say, the brain, how important, because people say that, okay, exercise is good, it's good for your health overall, so heart disease, can we directly link strength training or cardiovascular exercise to better brain health?
Yeah, it is. So it is same. So as we said in the beginning of our talk, it's a vascular thing.
Right.
So strength training, not so much for the brain activity because it's not directly related. But the cardiovascular, 100%. Proven things that you reduce your chances of stroke, you increase the blood supply to the brain, it will increase your memory, your concentration power, and probably it's not joint as of today, but probably chances of you having dementia goes down significantly. Okay.
Right.
So it's early studies, but shows that if you exercise 30 minutes a day, chances of dementia is pushed away by a decade or so.
I read some studies which suggested strength training also helps with better executive function, where decision making, working memory, inhibitory control, all these things sort of were factored in when they were trying to conduct these studies, meta-analyses across.
I'm sure, I'm not denying it, but to my knowledge, like if I have to choose between cardiovascular and
You
strength
choose
training,
cardiovascular.
cardiac exercises, which increases your heart rate and blood flow, will have more significant direct benefit.
Yeah.
Strength training will have maybe a more indirect benefit to the mental health.
Because then strength training also boosts dopaminergic pathways about
That
how
is
you
true.
look.
That is true.
and all
So,
these
so
things.
you get everything. You get serotonin also.
Correct.
You get reward also. What is more important is also, like, I do exercise myself,
Right.
and for me that's my meditation time also.
Right.
So I don't know if you can segregate these two really. So when you are doing your strength training, you are focused. You are sort of meditating also at that time. You are trying that, okay, let me do this, and trying to push yourself. So all these things will factor it.
Correct.
But what I'm trying to tell you is I have not read across a direct scientific study saying okay, we studied 100 individuals and this was the difference we found.
Maybe it's an outcome,
It's an indirect outcome of
indirect
that.
outcome. Right. And does it have anything to do with how your synaptic connections are, how strong your brain is able to relay the message through your nervous system? All of those things maybe.
So that is independent of your muscular activity.
Okay.
That is just re-repeating it. So that's how the memory is formed.
Right.
So I don't know if you have realized, it's a very interesting thought process. You do something once, then you something again, and then something again.
Right.
It becomes easier and easier
Correct.
because those connections form in the brain.
Right.
So that is due to those neuronal connections which are forming.
Right.
So you keep doing something repeatedly again and again, and the brain just learns that task.
Right.
That's why, to circle back to the same point,
Right.
that at some point you need to come out of your comfort zone, do something different, pick up a new hobby, try to play a new instrument, new language. So your brain is forced to think,
Right.
forced to exert more than what it usually does.
Right. So you're working it like a muscle.
Correct.
Right.
We call it like a muscle level. It's not a muscle level. It's the pathway is formed. So it's like a command. So it's like a switch.
Right.
Like right now, I'm out of my comfort zone talking to you. So my brain is exerting. But when I'm in my OPD, I'm talking to my patients.
Right.
I know what I have to tell them. I do this same thing in and out again. So it's not really mental exercise for me.
Could you tell us a little bit about BDNF, brain-derived neurotrophic factor?
Okay, so I am not really the expert for that. I will like to skip that part
No
if
problem,
you
no
can.
problem.
So because
Yeah. Coming back to what it is that you do, could you tell us a couple of diseases that you encounter on a daily basis, which, are lifestyle related maybe?
okay, so a lot of things we have talked about, like especially stroke and disease of the arteries. The one thing which is most prevalent and we have not talked about is migraine, tension headaches,
Right.
stress headaches.
Right.
So many people do suffer from it. And I think with the awareness increasing, more people are aware that they should seek help for it. And again, they are mostly lifestyle related.
Right.
So the triggers are lifestyle related: lack of sleep, lack of food, lack of water, exercise,
Yeah.
direct exposure to sunlight, stress, anxiety, not able to handle oneself. They are so common triggers of continuous headaches, outburst of headaches. People do sometimes even get paralyzed by headaches,
Wow.
that they will feel that I just can't move now. Like I am not able to move one side and they are having bursting headaches. They will be rushed to the emergencies. We check and we say it's nothing, it's just headache.
Right.
So most of the times, 80 to 90% of the time, it's just the counseling, asking them to change their lifestyle, asking them to avoid triggers and give some medications for acute pain relief. And they get cured and they get off medications, go back to their normal lifestyle till they relapse again like a drug addict.
Right. Because I've seen people with migraines, like a catch-22. You have migraine, you can't sleep. You can't sleep, you get migraine.
Yeah.
It's more or less going hand in hand. You have migraine, you can't work out. So then this vicious.
See, we have to understand our body, what my body can take. Maybe my body needs to sleep at 10. I'm pushing it to 12 every day. It won't like it. It will trigger.
Right.
Once it gets triggered, then there are chemicals released. Till the time that inflammation settles down, it won't let you settle down.
Right.
So you will need pharmacotherapy for that acute phase.
Right.
Then there are 10-15% of cases who will have repeated outbursts of these inflammatory markers, no matter what you do. So they will need continuous pharmacotherapy for that.
Right.
But for most of them, once that acute phase is gone and they are able to, everybody has a different trigger. If they are able to highlight and understand, lack of sleep and lack of water are two prominent big things. People do not realize they are not drinking water these days.
That's true.
So, and that triggers a lot. And it's surprising when you talk to not only patients, maybe you can just talk to people around you and you ask how much you drank today, and you'll be surprised they will not have an answer for you.
True. That is true. Do you have any questions in case you want to ask?
So I just want to see that when you interact with so many people, and I'm sure you interact with a lot of other specialties and fitness and other thing, you have been in this field for 20 years now.
Yeah.
How do you see it all coming around? What's the common hinge point which you see
As an industry or for people's?
for people, individual health?
I think when you sort of create enough awareness, right? And a lot of self-awareness is important. Like you said, people don't realize how much water they've had, what sort of foods they've indulged. In fact, if I were to ask some people what they eat yesterday, they can't really recall. So when I'm meeting somebody for the first time, a questionnaire is the worst way to assess somebody's lifestyle, because recall is a very poor way of collecting data. As I see the whole theme coming together with longevity, a lot of popular people bringing longevity on the table, David Sinclair, Dr. Peter Attia, all these individuals talking about it, people getting more aware, individuals such as you recommending exercise, all the doctors recommending exercise for metabolic health, mechanical health, all those things. I think India should see, and with the healthcare system, like you said, cost of certain procedures coming down, certain medications coming down. Also, an MRI at some point was more expensive, now slightly cheaper. All these things coming together, I think we can look at extended overall lifespan for a lot of individuals.
100% I agree with you.
I think it's about 72 right now, average Indian lifespan, 72, 74.
74, but the last census was like 14 years back. So we are in need of a new census and tell us that, lifespan is really going up from
Correct.
there.
And the most important thing that I think exercise brings to the table with what we recommend to people is an increase in health span. So a health span would be, let's say there's somebody who's had some sort of disease. And like you said in the beginning of the podcast, that you to enjoy whatever it is that you've created for yourself, whether it's wealth, family, company, name, fame, anything, you need to be able-bodied.
Correct.
You need to be in the prime of your health, or abilities at least, to be able to, have satiety in that situation or feel that you've led a great life. I have had the honor of meeting many, many individuals who are old and ailing, and they're multi-billionaires. But what wouldn't they give to get off from that wheelchair?
Absolutely. Absolutely.
So I think perspectives are changing. I think at one point, once people have their food, clothing, shelter, everything sorted, it is imperative that, people should go and explore Europe a little bit. In general, people there, they've got like 4 days a week, 5 days a week, work-life balance. And like you said, it's a myth maybe, because, aap to doctor ho 100%, there is no balance. But people should have a larger perspective in life. They should know that life is a lot more than just being a narrative, and health is equally important. It has an environmental impact. It has an impact on your family, your loved ones, and also your dreams.
So European vacation is what you're suggesting to
100%.
Okay. That's a good take home.
Right. Or at least knowing the perspective, because they've sort of had wealth for the longest time. India also did, but then we had this sudden setback with the British coming in, taking everything away, so leaving us in shambles. We had to rebuild again. And now we see a lot of those insecurities weaning off, people trying to see, okay, there's other perspectives to life as well.
Yeah. All right.
Done? Anything else at all?
That's it from my side. Thank you so much.
Done. Thank you so much. Thank you for your time, and we'll see you soon. Thank you, doctor.
All right.